friends, I am Soham Bera, Senior Consultant Optometrist from India. In previous video, I have already told you about what is Lasik and the procedure of the Lasik and what is the advantage and disadvantage of this Lasik. But today I am going to tell you about Lasik risk and complications. So let's start it with. Lasik and other type of laser eye surgery such as PRK and Lasik have excellent safety profile and very high success rates. They are designed to treat myopia, nearsightedness, hyperopia, farsightedness and astigmatism, and can allow you to live without glasses or contact lenses. Sight-threatening complications such as significant loss of vision from Lasik surgery are extremely rare, and many side effects and laser eye surgery complications can be resolved with additional surgery or medical treatment. Lasik, like any other surgery, however, there are potential risks and side effects and limitations you should be fully aware of before electing to undergo procedure. Choosing a skilled, experienced Lasik eye surgeon can help reduce this risk and enable you to achieve the best possible result from laser eye surgery. The first step to determine if you are a good candidate for vision correction surgery, your eye doctor will perform a thorough diagnostic eye examination to determine your sustainability for Lasik surgery. He or she will evaluate the shape and thickness of the cornea, your refractive error and your pupil size, the moistness of your eyes to check for dry eye syndrome, your general health and medical history and any medication you are taking. Even if you are not a good candidate for Lasik, don't worry. You might still be able to have your vision fixed with other vision correction surgery such as PRK, Lasik or implantable lenses. Lasik eye surgery risk and limitations. Not everyone is suitable candidate for Lasik eye surgery. Certain condition and anatomical factor can increase your risk for an undesirable outcome or limit optimal Lasik result. This includes first, too thin or irregular corneas, large pupils, high refractive error, unstable vision, dry eye, your age, if you are pregnant, or if you have any certain degenerative or active autoimmune disorder. Millions of people have had Lasik eye surgery to correct their vision since it was introduced. Experienced Lasik surgeons report that serious complication rates can be below 1%. In case of best candidates, mild to moderate hyperopia, myopia or astigmatism, adequate corneal thickness, the procedure time about 10 minutes per eye, typical results almost 6 vision without glasses or contact lenses, recovery time a few days to several weeks for vision to stabilize. Common Lasik complications and side effects are listed below. Most of this problem can be resolved with medical treatment and additional enhancement surgery. Temporary discomfort and vision disturbance. Discomfort during the first few days following Lasik surgery, such as mild irritation and light sensitivity, is normal and to be expected. During the first few weeks or months, you also may experience halos, glares and starbursts in low light environment, especially at night. Dry eye symptoms, hazy vision and reduced sharpness of vision. In the vast majority of cases, these problems are temporary and disappear completely within 3 to 6 months. Flap complication. The Lasik procedure involves the certain of a thin hinges flap on the front surface of the cornea. This is lifted during the surgery. The front surface, and we call it epithelium, the outermost layer of cornea. In time of doing Lasik, we have to lift this surface. This is lifted during surgery for laser reshaping of the cornea. The flap is then replaced to form a natural bandage. If the Lasik flap is not made correctly, it may fall to adhere properly to the eye surface, or microscopic wrinkles called stray could develop in the flap. This flap complication can cause optical aberration and distorted vision. Again, remember that you can reduce your risk of Lasik complication by choosing a reputable, experienced eye surgeon. Some problems associated with Lasik flap complications include: first, irregular astigmatism. This is caused by unequally curved corneal surface. Irregular astigmatism also can occur from laser correction that is not centered properly on the eye or from irregular healing. Resulting symptoms may include double vision, diplopia, or ghost image. In these cases, the eye may need to retreatment or enhancement surgery. Second, epithelial growth. This is when cells from the outer layer of the cornea, epithelium, grow under the flap after Lasik surgery. In most cases, epithelium ingrowth is self-limiting and cause no problem. But in some cases, symptoms of discomfort and blurred visions can occur. An additional surgery is needed to lift the flap and remove the epithelial cell. Diffuse lamellar keratitis, nicknamed sands on the sclera. This is an inflammation under the Lasik flap that may have several causes. Some inflammation of the cornea after Lasik surgery is normal, but it is uncontrolled. As in DLK, it can interfere with healing and cause vision loss if DLK occurs. It usually responds to the therapies such as antibiotics and topical steroids. Also, the flap might need to be lifted and cleaned for removal of inflammatory cell and to prevent tissue damage. Keratectasia or keratoconus. This is very uncommon bulging of the eye surface that can occur if too much tissue is removed from the cornea during Lasik, or if the cornea prior to Lasik is weak, as evidenced from corneal topography mapping. Rarely does keratoconus develop after Lasik with no non-risk factor. Enhancement laser surgery is usually not suitable, and gas permeable contact lens or corneal implants intakes may be prescribed to hold the cornea in place, or a treatment called corneal collagen cross-linking may be performed to strengthen the cornea. Dry eyes after Lasik. Some people who have Lasik surgery experience decrease in tear production that can cause eye discomfort and blurred vision. Almost half of all Lasik patients experience some degree of temporary dry eye syndrome. According to symptoms, dry eye syndromes after Lasik surgery usually is temporary and can be effectively treated with lubricating eye drops or other measures. Dry eye problem usually disappears when healing of the eye is complete, which can take up to 6 months. People who already have several dry eye usually eliminate the Lasik candidate. People who already have severe dry eye usually are eliminated as Lasik candidate. Another complication, significant undercorrection or overcorrection or regression. Not everyone will achieve 20/20 or 6/6 vision after Lasik eye surgery, and contact lens or eyeglasses for some of all activities may still be required in rare cases. If the laser removes too much or too little corneal tissue, or your eye healing response is too typical, your visual outcome will be less than optimal. One possible cause of a less than perfect outcome is that your eyes didn't respond to laser eye surgery in a predictable manner. Another possible cause is that your eyesight may have been optimal shortly after Lasik but regressed over time due to overhealing. In most cases, a significant undercorrection or regression can be successfully treated with additional laser vision correction after your surgeon confirms your residual refractive error is stable. Eye infection. Infections rarely occur after Lasik because the corneal flap acts as a natural bandage. Eye infection occurs less frequently after Lasik than after flap-free corneal refractive procedure like PRK. Still, it is very important to use medicated eye drop as directed after your Lasik procedure to avoid infection and control inflammation as your eyes heal. How common are Lasik complications? The safety and effectiveness of Lasik surgery continues to improve thanks to increasingly sophisticated technology, surgical skill, and optimal patient selection. A worldwide review of Lasik published in 2009 showed that more than 95% of people who had LASIK surgery between 1995 to 2003 were satisfied with their outcome. Public confidence in LASIK has grown in recent years due to the solid success rate of LASIK surgeons' outcome. LASIK outcomes have been laser eye surgery has successfully treated millions of patients and has a high potential satisfaction rate. However, as with an eye surgery, LASIK involves potential complication. It is important for you to weigh the benefits and risks before choosing to go ahead with surgery. Eyewear after LASIK. Though the goal of LASIK surgery is to eliminate your need for glasses or contact lenses as much as possible, for some cases you may benefit from wearing glasses part-time or full-time after a LASIK procedure. For example, for persistent dry eye problem after LASIK, wearing eyeglasses with photochromatic lens can help relieve photophobia sensitivity to light associated with dry eye. For a case of mild residual refractive error, then don't warrant additional surgery. Wearing corrective eyeglasses for specific visual tasks such as driving at night is a good choice. If you can benefit from glasses after LASIK, choose lens with anti-reflective coating for the best vision and comfort possible. Also, if you over age 40, consider a progressive lens to provide enhanced vision for reading as well as supervision in distance.